One thing that's always constant is change. Change is happening ubiquitous all the time. Change is happening also in human bodies. The change that happens in human bodies from a newborn to an infant to a toddler to an adolescent and then to an adult is about changes happening in control mechanisms, changes happening in organ growth, change happening to a level where all the organs finally make you an adult human being with organs in shape and functioning. So the anatomy and function of organs gradually undergoes a migration towards betterment till a point in time. So you move up the ladder, you reach the pinnacle or the peak, and then there could be something which we don't expect. That is called as a change which is inevitable, a change of aging, a change that probably brings about aspects that we probably happen without our permission, without our knowledge, and that change is something which we need to talk today. Helen Keller said, "A bend in the road is not the end of the road unless you fail to make the turn." That, in other words, you fail to identify and understand that something which is happening is known to you, it's either ignored or possibly not understood. So, awareness is the key to early management of various diseases. And that's where, in an aspect of care, in an aspect of health, very important for me to discuss that aspect today with all of you. As I said, as organs undergo a change, the change probably will bring about many untoward things which we never knew about. For classical example, number one is the organs which undergo a change, prostate. Hormones in men change, they don't develop menopause. What they develop is changes happening because of hormones. They may become less agile, they may possibly become weaker and more tired in the evenings compared to their capabilities, which was 15 to 20 hours a day. They could be strong, capable, working, traveling. As in the evening of life beyond 50s to 80s, men start gracefully aging. Many of things happen without their permission, without their knowledge. Hormones bring about a change in the prostate. And people probably come up with health checkup and find an enlarged prostate. People come and probably complain of urgency, frequency, and urge incontinence because the bladder has taken charge and is contracting erratically in the background of the prostate, which is occluding the urinary passage, or there are changes happening in men's health and sexuality. So basically, when we look at that kind of a change which man goes through, an aspect of change is prostate and prostatism. One needs to be aware of that because prostate undergoes a kind of a change internally, quite deep in the pelvis where we can't reach. A urologist does a digital rectal examination, identifies the prostate, feels it, gets to know and probably suspects some diseases out of it, apart from the enlargement and grading the sizes. It is important for you to see your urologist beyond 50, only because changes happen very silently. Change in the prostatic size is picked up by your sonologist and health checkup, or you would do sonography for some reason. But change in the consistency, change in the suspiciousness of another lineage called the cancer prostate is something which is not picked up by you. Not that always a PSA level will pick up a cancer prostate. So it's important for us to see our urologist beyond 50, only for reasons that there are progressive, gradual, silent changes happening until we reach the end of the road. And that's where if we can't negotiate it, we may fall down. What does it mean? We may fall down in terms of a gradual progression of obstruction to the flow of urine that we perhaps forgot, we ignored in our busy life and practice. And one fine day, we find the urine coming very slow. One of these wintry nights or one of these holiday nights on a weekend when nobody is available, you also land up in retention or blockage of urine. So important for you to identify that change is almost constant. And in a male, changes of that kind, where his health, his sexuality, his capability, his erections, his urinary flow, all those are changing. There is no one fine day where a man develops menopause, like women stop menstruating, and that's the day they are called menopausal. It doesn't happen in men. And therefore, because it's very gradual, it doesn't have a day or a week to mark around. People continue to work hard in their lives in those 50s and 60s where testosterone is undergoing a change. That brings about a lot of loss of vigor, loss of capability, loss of focus that they have, and a lot of tiredness and weariness late in the evenings and nights. They come back home tired. The hormones are changing out there. While hormones are undergoing a change from testosterone to dihydrotestosterone, the prostate is undergoing a change. It's changing in one side, enlarging and becoming bigger. Bigger necessarily may also be bringing about an occlusion to the urinary passage, and your urinary flow gets lesser and lesser. On the other side, there could be change towards an unsuspected cancer prostate. And this is all what a urologist would pick up. So if you are in your 50s to 80s, if you have got any urinary complaints, see a urologist. If you have got an issue where you're going a health checkup and you picked up a very small stone in the kidney, please don't ignore it. A stone which is small today will become big and bigger. A stone which is small today has a capability of falling down the ureter and blocking the urinary pipe at unearthly hours when you're probably holidaying or you are in thick of a work or probably a travel. And the stone would fall down on one side, block your ureter, and you would expect that it would come out. Not necessary. The urinary pipe called the ureter, which brings about the urine from the kidney and down into the receptacle called the bladder, is a very narrow pipe. It may be broad at the top, and therefore a stone may get inside. But to get out, it's actually getting into more and more entrapment of a narrower and narrower and a narrower passage to the narrowest at the vesico-ureteric junction, the narrowest part. So sometimes even a 3, 4, 5 millimeter stone can get blocked there. And hoping that it will come out may not happen a day or a week later, because in the early days, the stone may possibly have just fallen down. Later on, it makes an attempt to come out, and in doing so, it probably is not able to come out because by the time there's an internal swelling or edema developing around, and that chokes the stone more and more. So urologist advises that probably the stone has to be removed, and that's important. Stone removal is not a huge surgery, but that's only a pilot knows what is flying a plane. Similarly, a urologist knows what does it mean to enter a very narrow 2 to 4 millimeter ureter very safely and undertake that safe procedure where he goes in, does a laser lithotripsy, fragments the stone, and because of the edema or the tightness, puts a stent across and safeguards your kidney and the block system that you have around, which you've been sitting on with a blocked ureter for quite some time. Therefore, change is constant on stones. If you are a stone former today, you could form stones again tomorrow. And therefore, one needs to look at a metabolic workup. One needs to see a urologist when you are having a past stone. Once in a year, your sonography could pick up a stone. And if it's picked up one, remember the natural history of a stone is either growth. It can only get bigger and bigger in due course of time very silently. Again, without your knowledge and permission, and one fine day, you actually have a stone which is huge inside and you are astounded. No pain, no discomfort, no bleeding, and the stone is so big. How did it get implanted into my kidney? Not implanted. It actually grew gradually without your knowledge and permission. Therefore, friends, the change in the stone is very gradual till one fine day you wake up to an ultrasound showing a large stone, which we actually puncture, go inside, powder the stone and remove it. Or we do a laser lithotripsy or do a flexible ureteroscopy and clear the stone. Unfortunately, it should not fall down in the ureter and block the narrow pipe like a car coming out of the garage and blocking the main road. And you have no choices but to probably see a urologist more so in emergency. So that's a change. So urological diseases of that kind where a hormone change brings about change in prostate, which necessarily in all men beyond 50s, gracefully aging into 70s, 80s will have changes in the prostate. Men are very unsuspicious when they see a urologist. Many times you ask them to do a test called uroflowmetry, passing urine in a computerized toilet. And what does it tell? It tells you about the pattern of flow. It tells you about the speed of flow. It tells you the kind of pattern you have, how much urine is actually left over when you perform as a student in the exam. The report card of yours is called uroflowmetry. So you perform your best flow in full bladder in a machine which is attached to a computer. And the way you pass urine brings about a graph like an ECG. I call uroflowmetry as an ECG of the bladder. It gives everything that you wanted. The kind of the flow pattern, the amount of hesitancy, the time you took to start, the time you took to complete, the kind of staccato pattern you have, the dribble and the drop. At the end of all this performance, you think you're passed the exam. We check a real-time post-war residue immediately after your performance and find how much is left in the bladder. So both what is left in the bladder and the way you pass urine, the pattern and the speed of it, all gives an idea as to how silently things have changed without your knowledge. Or you have been taking medicines and hoping that things are changing and it's not changing. So any and everybody who is in his 50s to 80s undergoing a urological checkup or a health checkup in our country sees a urologist, is evaluated by a uroflowmetry, by a serum PSA, by a sonography, and the compendium of all this is done only after a history taking or a discussion happens across this consult table. We discuss with you all that we need to know in your urological history, which includes how many times you get up at night, do you bedwet, in the daytime, are you able to control urine or your bladder is erratically contracting in the background of an obstruction, or you're having an overactive bladder only without an obstruction to the flow of urine. All this gives an idea as to where have you moved in the journey of a progressive change in the lower urinary passage, which necessarily at some time can be troublesome. And therefore, all men need to see their urologist in the city. Something very, very important. You don't want to get a surprise on a Saturday evening of a stone falling down the kidney. You don't want obstruction, which you probably pick up on a Saturday night, see that my urine is not coming, what to do next? And you need to then dial you for urologist, look at who is available in your location and probably get sorted out. So friends, as men, we undergo this change. It is important for us to see our urologist in time, because you should see a urologist for all this. A urologist is also an andrologist at the Kokilaben Hospital, that I see so much of andrology and men's health and men's sexual health. I understand they are falling from grace, their capabilities are gradually going down, and it's important to handhold the journey of getting them better on that aspect also, which is so much earmarked with shame and with disgust and with agony and discomfort. They don't know whom to discuss with while their partnership is getting into trouble. So, friends, it is important for us to look at our health. In the era that you learned from the pandemic so much, it is important to go back and look at how are we in all aspects of health. Like you get your heart polished with angioplasty and a bypass surgery, like you get various changes being done and you polish yourself. It is important to look at urological health, which sadly is progressive, which is progressive very silently. It does not make noises unless you're only aware of your changes happening. So if somebody has got an obstruction to the flow of urine, somebody passes urine with a dribble, somebody does not empty his urine completely, somebody finds that the bladder is still full after having emptied, or goes multiple times to pass urine, and the stream is very thin for a long time, or is on medication for prostate diseases by his colleagues or general practitioners or urologists, and is not finding a relief and is still stuck with medicines with the same result, I think we need to redo the whole thing. It's possibly important at this point that you see your urologist again. The whole thing is looked at and probably picked up in a better way. And that is the way we look at safeguarding urological health in future. It's important that we don't miss out on this important quality time that we have as we gracefully age, prostate undergoing a change, men's health undergoing a change, stones happening, recurrent urinary tract infections developing, erectile function worsening into a situation from where you can only be salvaged. Sometimes men come with Peyronie's disease or complete bend in the organ, something which we treat and straighten it up. So isn't it time for you in your 50s and beyond to not postpone this important aspect of what you live in agony and shame and discomfort, to actually own up to a urologist in your city and probably get it sorted out? At the Kokilabenhospitalmumbai Hospital in the Department of Urology, we look at A to Z of aspects of urological care. Everything right from preventing infections, looking at safeguarding your urological health, looking at your prostate and looking at your uroflowmetry and seeing and doing a kind of Bhavishyavani for tomorrow, that you don't land up in any kind of an obstruction, identifying those who are in trouble with uroflowmetry and urodynamics, treating them in a right approach to the right individual, are mottos that we follow. In other words, Monday to Saturday between morning 8 to evening 8, we have got people coming in to show themselves on aspects that has been postponed or has been treated but not got a care. Important for you to identify yourself as an individual who needs a care, who needs to polish his urological health today so that you have got better tomorrows. Every life matters, including yours. And therefore, don't miss out on this important aspect of taking care of your urological health, because it will change before it becomes too late. Thank you so much.